So today we are going to show you one very interesting case, which is uterine septum resection. Look at the screen. This patient is having huge uterine septum. On one side, her uterus is literally divided into two halves because of this septum, wherein uterus on one side patient has right fallopian tube open, on left side also patient has her left fallopian tube open. Now our goal is to make sure that we cut this septum and make patient's uterus absolutely anatomically normal, so that going forward patient will not face any problems in terms of conception or abortion. Now the instrument which we are using today is called as resectoscope. With this resectoscope, what we do is we ensure that we can cut this septum without the risk of bleeding. Now you see this is the procedure where we are beginning now, and now literally in couple of minutes we will cut this septum. सक्शन बंद करा. Now you see this, we are already halfway through, where we want to check her corneo levels, and with that we can achieve complete resection. So what happens is, many a times patients with these septums, no, they usually present with history of abortions. They have multiple abortions, and because of multiple abortions, ultimately finally patient gives up hope of conceiving. While the problem is, in these patients they are suffering from this which is called as a septum. Once we treat this septum, patient's uterus is absolutely normal. They do not require any further treatment. Although important thing to note here is, once we do this resection, we tell the patient to conceive only after 3 months, because that much time is required for her uterus to regain the normal strength. Also, it is important to note that many patients where we have done massive resections, we advise them to go for C-sections at the time of childbirth to prevent any risk of uterine rupture, which may happen in certain cases. Although it is not a must, but we do advise for certain couples that they should undergo C-section at the time of delivery. You see how nicely the septum is getting cut now. The trick of septum resection is not only cutting the septum, but also ensuring that we cut in the same plane without damaging additional layers of the endometrium, and also ensuring that we don't overdo it as well as we don't underdo it. See this? Now almost we are nearing to the completion, where nicely we are now looking at the fundus. Almost 75% septum is cut now. Now this is going to be a vascular part of the septum, so we have to proceed with caution. If you look at closely, we are ensuring that the septum is being cut only in one plane. We are making sure that we are not going haphazardly. We are ensuring that the resection is happening only in one plane. Now what we have achieved is, we have achieved complete clearance of this septum, and in that process we have also ensured that her uterus is absolutely unharmed. By doing this way, what we have ensured is, patient's fallopian tubes, since they are open on this side as well as on the other side, this patient can easily conceive with the simple either follicular studies, or patient simply can plan naturally, but patient will not require any further advanced treatments. And also this patient, after conceiving naturally, will not have any sort of untoward events, will not have abortion, will not have any problem. Only thing is, this patient may require C-section at the time of delivery, that's all. So that's the beauty of hysteroscopic procedures, wherein we can treat patients' problems in one go and after that it allows patients to conceive naturally, and it also allows patients to not to have any problem during their antenatal period. Thank you.